Standard Bank. It can be.
Welcome back. Well, let's get an update on COVID-19 now. In India, hospitals are full. Some are running out of oxygen. The country is reporting over 350,000 new cases of COVID-19 every day. One of the reasons for the rapid transmission of the virus there is being spread by what is being called a double mutation variant. In other words, a variant of the virus where the virus itself has two new mutations compared to what happened before. In other words, the difference between the variant which was discovered here and the first variant was one mutation. In this case, it's two mutations. Not being entirely scientifically accurate, but that's how it's been explained to me. Professor Ramneek Ahluwalia is the CEO of Higher Health. He joins us now. Professor, good afternoon to you. Start with the simple stuff. How different is this variant of the virus compared to the other variants, the two variants that we've had here? How different is this variant?
Good afternoon, Stephen, and good afternoon to everyone. Stephen, this is definitely a variant of concern and a variant of interest. This virus is mutating. So first of all, the double mutant, as we call it, is a misnomer. Actually, we've seen 13 mutations in the same variant. And the important reason why we call it a double mutant is because of two mutations which are experienced in the same variant, and predominantly the mutation that are seen on the spike protein, which is of huge concern for us. And the two mutations that you are seeing, we call them as L452R, mutation very similar to the variant we saw in California. And the other mutation is E484Q, which is very similar to the variant we first detected in South Africa, which caused a havoc of our second wave, which was also very similar to the P1 variant, which is kind of the biggest wave, the reason of the wave in Brazil at this moment. So these are the two big mutations that we are following very deeply at this moment. Now, what does this mean is that, the interesting part is that when the first wave hit India, it was estimated that close to about 271 million people, or around 300 million people, got asymptomatically infected or symptomatically infected and developed natural immunity to this COVID virus, which was the variant that was causing the initial surge of the first wave. But this second wave is of a massive interest now, is that reinfections, which means the new mutations that are being now circulating in India, which we call as double mutant, the variant that was detected in UK is also in India. There are a number of variants that have caused this massive surge in India, means that the antibodies or the human immune response, so these variants now escape, so call them escape mutants. And escape mutants escape the immune response, which is a natural immunity produced by humans against this virus. And that is of a concern. And similarly, we've seen studies from Brazil, which is also indicating that if you are infected with COVID in the first wave, or say in a second wave, these possible mutants that are now building themselves into kind of variants that can escape the immune response which was produced through the natural immunity. Still, what is still not clear when science is studying is these mutants that are causing the second wave, our second wave, which just finished, has produced natural immunity in humans. Is this possibility that our immunity is still intact towards the second wave? And that has not yet been established. And that is something which is a huge concern for us.
Okay,
what's happening in India is concerning.
So sorry to interrupt. So just to understand this, I mean, it might mean that someone here, I mean, many people here, myself included, will have had COVID-19 at some point. And we might find that, in fact, the variant we're seeing in India now gives you COVID-19 again, and you might have it very differently. You might have had a very light dose of it, if I can call it that. You could have it again and develop severe symptoms.
So yes, absolutely. The symptoms, the transmissibility rates are very, very high, like we saw in second wave of the variant that was detected in South Africa. A very similar picture is seen in India with this double mutant and other variants which have shown very high transmissibility. Now, the other thing which is of interest in every virus is the virulence part, which is how severe the infections can be. Now infections which are even moderately severe, and it depends on old age, comorbidities, but the challenge comes is when your health systems becomes completely jam-packed with so many infections at the same time coming in, your oxygen supplies, your early reaction to your human support is not there, then this virus takes a very lethal format and develops into a severe infection, and even the moderate cases that could be assisted and reverted back into normal, into normal infection, would end up into severe, and mortality and death start becoming increasing because of the deficiency of healthcare system. It's in any part of the world, US, France, UK, India, South Africa, we all will experience a similar surges around the huge number of cases coming. Now, the answer to your question is that the natural immunity of the second wave, which happened in South Africa, we do not know how many people did not even test, which were asymptomatic and had the natural immunity. And those natural immunity is still standing in place for these new mutants that we have now started experiencing in parts of Asia and Central and Southeast Asia, and specifically India. When they cross-migrate to Africa, we started seeing cases coming in Africa now being reported. And when they land our shores, what probabilities they have to our immune system. And that's going to be the question that needs to be answered with science for now.
So I mean, there are obviously questions that emerge. I mean, one of the questions is, do we need to immediately stop people who've been in India, who might have been exposed to this variant, from coming into South Africa? But before that decision is made by government and the scientists, is it possible to say for certain that there isn't already a patient in South Africa who has this variant of the disease?
For now, no. So far, as per any reports which we have experienced or seen, remember, most of these things come from cluster outbreaks. You know, there's a cluster of infections, like in higher education itself, and what happened in University of Pretoria. You have a lot of students at one time, a lot of people in congregate setting becoming positive. That's an indication of something to look into and say, is there a new mutant virus which is highly transmissible, escaping the immune antibody system of existing, or is this something which we need to now see? And that helps us pick whether there is a new infected mutant or a variant in this country, which is going to be of a massive concern to us. So far, no in South Africa. So far, no in Africa. But there are now cases coming from Uganda that is kind of showing that there has been this variant now detected in Uganda at this moment, or in other parts of Africa, but not in South Africa. But cross-migration is happening quite quickly. So it's a matter of time. These surges do happen. One thing is for sure, the virus will continue to mutate. Virus wants to survive. That's the reality of it. And virus is trying to say, if you have an immune reaction against me, you produced antibodies to fight me, I'll try to formulate myself, I'll try to mutate in such a way that I will escape these antibodies and try to become such a mutant that can attach to the cells of human body and cause and give myself a chance to survive in a human body. All this virus is doing is trying to survive in human body. But the problem is, if it starts moving from one individual to the other, and if we do not control it, it gets a higher chances to mutate. It gets a freedom to mutate. And what we need is exactly what we are being telling that everybody should be vaccinating is, because clearly even the Indian double mutant has shown that vaccinations are effective against these mutant variants, which means the immunity that the vaccines produce is far stronger than the natural immunity that humans produce once they get an asymptomatic or a mildly symptomatic COVID infection. So this means that if vaccinated people are there, this means that the virus will not have the liberty to move from one individual to the other, in return also not cause mutations, and also in return also not become the kind of surges that we see through such mutants that are called escape mutants.
It's such a complicated situation. I mean, if we really, I suppose the only thing we can do is vaccinate, and vaccinate as quickly as we can and sort of go from there. And even if we wanted to say people who've been to India can't come here, it wouldn't necessarily stop the variant from coming here in the first place anyway, because that's just not how a virus moves. What we really want is for the virus to evolve to be less harmful to us.
Absolutely, Stephen. If not the cross-migration of the mutants or the variants. See, the variant in India is also a variant from UK. The variant that was first seen in UK is a huge variant that is causing havoc in India at this moment. We've experienced a variant that was detected in South Africa. So these mutations are going to happen in every part of the world, as long as the virus keeps moving from one individual to the other. And it will find some bodies or human, and these are signs that will come that where the virus finds more joy, it likes to mutate and finds itself to adapt into a mutant that it makes it flourish further or disseminate further into many humans. So I think irrespective the virus comes from, this double mutant comes to India, from India to South Africa, which we have to watch because we do not know its immune reaction to our population who's just gone through the second wave, but also the mutations that are happening in South Africa or in adjoining countries which are having cross migration with us, which will definitely end up into a situation where we need to keep watching these clusters of outbreaks that happen, quickly investigate these clusters, find a variant that is different from the variant that caused. We will find mutations, but most of these mutations are not problematic or not of concern. But certain mutations we need to pick very early, which are of a high concern, so that we can act early and we can kind of prevent what we could not prevent, a second wave, or what we're seeing in India at this moment.
Professor Ramneek Ahluwalia, really do appreciate the time. Thank you very much indeed. CEO of Higher Health. Just the most difficult situation developing in India at the moment. It really just tells you as well, I suppose, how important vaccinations are. More to come in a moment. The most astonishing story published by the Amabungani Centre for Investigative Journalism this morning about electricity, the production of electricity, and a claim of corruption. All of that to come in the next little while. Stay with us here on Newsroom.